the heart is so weak that you have now got the defibrillator, you have got the CRT, you've got all the medications, the patient is following all the classical lifestyle changes, but the patient's heart is not improving and the patient is on the transplant list. But there aren't enough transplants available, there aren't enough donor hearts. So how do we tide the patient till he or she can get their heart transplant? So this device is called a left ventricular assist device. What that means is that the heart is so weak it cannot pump, but the heart is getting blood. So if you look here, this is a small tube that's placed in this pumping chamber, and this sucks out blood, and this little device here is the pump which receives blood from here and pumps it into the aorta. So this heart is kind of just a conduit, but this is what's doing the real pumping. So in the past, these patients had to be hospitalized, live in the ICU beds. They had a wall socket and they were connected to the battery and the source of power. Now they can move around, and I'll show you that. So you can have a single vessel assist device, a single chamber left ventricular assist device, or you can have a biventricular assist device, one on the left side and one on the right side. This is done at specialized centers, and people, when they get LVADs, they actually, their life expectancy improves by a few months. Actually, it's almost more than a year to 2 years. They can have this while they are waiting to be on the transplant list. Here is a person. Now he's wearing it with a harness. So up till this point, it is inside and under the skin. From this point onwards, everything is outside. So here is the system controller. Here is the battery. Here is the pump. Blood comes out here, pumps up this way, and every generator and the battery source and power source are connected to it, and the person can actually walk around, wear proper clothes, and go do something. Sometimes with the LVAD, their heart actually, with the medications and time and revascularization, they get better. Sometimes they have to go on to cardiac transplant.